Hello, I have with me the next innovator for the day. Kindly introduce yourself.
Yeah, so I'm KV Venkatesh. I'm professor at IIT Bombay, and I'm also the founder director of Medflux Research Limited.
The innovation you presented inside today in the health tech category. Can you just shed some light on that?
Yeah, so this is outcome of what 25 years of research that's been going on in my lab. So through various PhD students and master students, so we've been developing physiological models. So these models, essentially, we started developing for different organs. So we have models for liver, adipose tissue, and then these models have been validated through clinical research, and which was a challenge. And that's why it took 20 years to come up with these validated models, and now it can be used for various applications.
So you have been innovating or in the process, in the journey for like good 2 decades. So there must be many learnings, many roadblocks that you must have come across. Can you just share some?
So, so because the healthcare process itself is very complex, right? Each individuals are different. Each they have their own experiences in their life, and they have their own genomics. The basic structure itself is different. So the hormone levels, the protein at which individual differs from one another is huge. So how do we capture this variability, right? So that is how I started approaching this problem, and the innovation came about because of this question that we asked, that how can we differentiate and personalize each individual. So for that, what are the basic parameters that are needed? And I started looking from an engineering perspective. As an engineer, if I want to look at physiology, how do I capture this? That's how the innovation sort of came about. And this is a huge challenge because the variability, you have to get data, you have to validate the data, and then you can say that okay, this captures. So even for example, what is a healthy status? Like that itself is, there is nothing like a healthy status. How do I define a healthy individual, right? Mathematically, I mean, in a model sense. So that itself is a challenge. For disease, I can say somebody has got diabetes. I know that his insulin is not working, or his some pathways are not working, and that's why glucose is not getting controlled. So disease I can understand because I can benchmark it. But health, how can I benchmark when each one is different? So typically this is also a problem, right? So most of the pharmaceutical companies which are abroad and multinationals, they do a clinical research on some population, and then they say that this drug is useful for this disease, and they push it worldwide. But is it applicable to Indians? So we don't know, because we are completely different from some other population. Right? So those variabilities now we can capture, and then so suddenly when we do this and we capture this challenge, the applications are numerous. So it can be in wellness, it can be in developing drugs, novel drugs, treatments, coming up with new treatments. So all this, these softwares can be now applied to. So the challenge always has been to get proper health data, right? So for Caucasians, this is very easy because there's a lot of documentation, there's a lot of data that is available. So if I want to benchmark Indians, right? So for example, what is the healthy cholesterol level among Indians? So if I ask this question, it's very relevant for the society, because that benchmarking tells the doctor whom to give medicine and whom not to. And so now if you just say that if there is a benchmark of 170 level of cholesterol, and beyond that you have to give medicine, it may not be true. For somebody else 240 may be normal for him. And then we are unnecessarily now medicating, right? So with these platforms, can we address these issues and then try to personalize and tell them that this individual needs this medicine, but this individual does not need, although the benchmarking is the same, right? So we can do that now, and then I think this will progress more and more with more data coming in, especially for Indians, and more data getting captured. I think our healthcare services will improve, disease management services will improve, but for that, these kinds of quantification and these kinds of models are needed.
So was the solution receptive enough as per what you thought of?
So everything has a, so if you're ahead of the curve, and then you have a innovation which is unique, then there is a challenge, right? So because people don't know about it, and then they don't know its applicability, its use, so you'll have to break that. right? So now, for example, we went to pharma companies and we said, you give your data. Okay, you don't tell me anything about the data. I will do the analysis and I'll give you a report. And then you see, whether it is useful or not, right? So we have to break through. We have to convince them that systems physiology is useful in the drug discovery. It will help you reduce the time in drug discovery. It will help you in reducing the money that you're going to spend. Your risks are going to go down. For that, you'll have to use such models, right? And you need to get data specifically for a population and then characterize. Right? So I'll give another very interesting example. So usually when a medicine is given, they say that they just say before lunch you take or after dinner you take. That's all they say. They don't tell you what to eat, right? So the food has a direct influence of the efficacy and the toxic effect of the drug, right? Because it's all complexly linked. It's the physiology, and many components are interplaying. So you cannot separate your lifestyle with the medication that is given, right? So supposing there are some drugs you take, for example, coffee. Okay, you take the drug with the coffee, for example, right? So the efficacy goes away because the coffee is going to switch on some pathways. Your medicine is supposed to switch on some pathways, and if they're counter, so your all benefits are gone. Okay? But the doctor or the pharmaceutical companies, they don't indicate that. Whereas this innovation will tell you that if you take if you take coffee along with this drug, right, so your efficacy is going to go down, right? Or in a population, this set of people, the efficacy is very high, but this set of people, this medicine will not work, right? So how can you benchmark this based on some physiological parameters that a medicine will work or not work, or how a lifestyle will work or not work? So these kinds of questions we can start asking, and then this has applications in drug discovery, in food formulations, in nutraceuticals. So in all this, these applications come, and benchmarking wellness, child wellness, in disease hospitals, doctors can use it for disease management. So this is what we want to apply these models that we have developed to these areas.
How you stand out of the competition?
So as I said, luckily, we are sort of ahead of the curve. So there are academic researchers who do develop models, and for them it is they want to understand a phenomenon, and for that they develop these models. Right? So and that's how I also started, because I'm an academician. I also started the journey in a similar way. So I wanted to know how hormones regulate, right? If I eat carbohydrate, protein, fat, that how does all this hormones interplay, and then how that final effect is. So the question was really fundamentally academic in nature, just understanding the problem. Right? So because we started the journey in that sense, right? And not that I'm going to innovate to go to market. Right? So my journey was completely different from others, because I started with an academic problem, saying that how these organs function, how they talk to each other, how hormones regulate. So because I wanted to understand the phenomena, so we built this model. Right? Whereas others, typically, they say that I want to go to market. This is the problem in the market. I want to solve it. So what is the solution towards that? So that's why the applications are really large, because I didn't even think about the application. I just wanted to build this these models, right? So that's why I can now use it for drug discovery. I can use it for wellness. I can use it for disease management. So the same platforms can be applied to different places, right? So as a competition, the other the so-called the thing to do nowadays, right, especially even in the healthcare, is to apply AI/ML, right? So you use artificial intelligence. So we are different from that, because we have physiological models. So we have all this just not data driven. So AI and ML are all just data driven, right? So you collect huge amount of data, right, and then you have an output. So you want to say that which of these correlates to the output. So I don't. It's a black box. So I don't know anything what is happening in middle. So I just say that these parameters are relevant for this output, right, which has a huge information, right? But we have the connecting dots as well, right? Just not the input output. So we have the connecting dots as well, right? So that is how we are different. So people are going for these solutions using the AI/ML route, right? And that is the competition in a way. Right? So but the approaches are completely different. So because we have developed models, physiology, how hormones. So AIML guy, he will see hormone may be a parameter in his input, for example. Right? That's all he will have. He will not say what that hormone is doing to give an output, but we have that physics captured. So we have the pathway captured. So that in that sense will always be different, right? And because this is a outcome of 2025 research, somebody to replicate this, will not be very easy, right? So he has to have a huge team, and he may do it in the 2-3 years, but it will not be like, for example, some other digital platforms that are there, right? So anybody can watch and then they can replicate it. Okay, although to implement in the market it may take time, but the technology itself can be very easily replicated. For example, e-retailing, right? So once the concept of e-retailing is there, anybody else can also sort of do it. They can copy the same. But here it is difficult because there is a lot of knowledge base that has gone in development of these products.
Professor Venkatesh, you're here for the first time with Aegis Graham Bell Awards. So how was your experience right from nominating the innovation to attending the jury round?
Yeah, so it's been a very good experience for me because this is also a first time for me, and because as I said, only last 2 years I've been like an entrepreneur along with being a professor. So the one is even going to the market, the other is going through this process is really novel and new to me, and so it has been a good learning experience also, because the type of in the nomination, the type of questions that are asked and then what we need to project is completely different from writing a paper, for example, for publication, right? So it makes you think in a perspective that how it is useful to the market, how we need to project some of these concepts. So starting from that, and all the support that we got in terms of the information that we got as to what has to be stressed, what is the goal of these awards, everything was very, very clear. So I think it's been a very good experience, and then the jury was also very supportive, and I think because the 10-minute slot was given, it sort of makes you think to project all the important innovation and the market readiness. So that focuses you to make that pitch, and I think the jury was also very receptive, and then this has been a very positive experience for me.
Thank you, Professor, for coming here, and we wish you all the best for the title.
Thanks a lot. Thanks a lot.